When you're not focused, you're not listening, you're going to ask repetitive questions. That will make the patient feel like this doctor is not paying attention, doesn't remember what I said. Pay close attention to what they say, make a note of it. And I think you are aware of it. And then when I explain to you, you realize, yes, she said that. So you did listen, but it may be that there's a lot of noise in your mind, and it's very difficult for you to think clearly. So you need to be a bit more focused and have clarity so that you don't forget things. And the second problem is the fact that you don't structure your consultation and you're missing the idea, concern, expectation, and the consultation is slightly disorganized and sometimes chaotic. So what we want to do is structure the consultation and organize it, making sure that you follow the framework. It is going to definitely affect your performance because we're human, and if something happening to us, it's going to affect the way that we talk and think. And like these thoughts that come, many of them, you can't really do much about it. So then what you can do is to set clear boundaries, as in when you're consulting, when you're preparing, when you're sitting your exam, focus only on the patient that you've got in front of you. That way, you will be more engaged in the scenario rather than having all these thoughts clouding your judgment and making it more difficult for you to progress. I'm glad that you're able to see the 1% because that's very important. Um, and focus on making small improvement, baby steps. Okay, because there's a lot of things going on with your preparation and it's going to have an impact if you like it or not. And be aware of that, and don't be too harsh on yourself. Because she's on microgynon, she's taking 3 weeks on, 1 week off. I would consider asking her to take it back to back without having a week off for 3 months. That way it can help in relieving her symptoms. With endometriosis, hormonal treatment is effective. So that's one of the options you could try as well. Okay. Also, when you're asking sensitive question, don't say sorry. I've got some sensitive question. Like the way you're asking it, it's making it more awkward. You want to like ask it in a way that shows that you've done it so many times. It's nothing that you're embarrassed about. So what I would do is, I've got some sensitive questions. If that's okay with you, then you ask your question: are you sexually active? Have you got any bleeding after intercourse? Any pain during intercourse? That way, it's going to show that you've done so many times of this gynae cases and you're not really embarrassed about asking. Okay. Yeah. So make sure that you focus on the idea, concern, expectation, and exploring the eyes systematically. Okay, I think that's the main thing that you want to fix first. If you don't fix that, then the rest is going to be an issue, major problem. Okay. Yeah, and then the second thing, once you fix that, would be make sure that you readdress the eyes, because exploring the eyes is one thing, but the second thing that's very important is to readdress the eyes so that you achieve shared understanding, and then you can go into shared management. Go back to your basics. That's going to be very important. So basics in terms of what we discussed, the anatomy of a consultation, how to consult well. I would go back and watch these lessons again, because then it's going to consolidate your learning and then you put it in practice. Okay. So it's been really good to work with you, and I can see that you have developed some improvement while we work together. There's still quite a gap, so I think in the next few weeks, if you implement this, you will see an improvement. Are you feeling anxious about the SCA preparation? Maybe you're not getting constructive feedback, you don't know whether you're doing the right thing. If you're looking for one-to-one support, I'd love to help you. Click the link down the description below to book a call with me to see how I can help you to pass your exam. Give us some numbers on a weekly basis, like a month before the exam. What was the frequency you were practicing, Divya?
So actually, I think December we didn't really actually practice anything, so it was mainly January that we were practicing really, and then that was sort of 3 times a week. So the month before the exam, we were practicing 3 times a week.
And how many cases were you doing in the practice
So
group?
we'd be doing about 2 each, and the study groups had 3 or 4 people in it. So getting through 6 cases roughly in each session.
What were the things that you thought was about this exam, and then you found out maybe I was wrong, or maybe you had some misconception, if any?
The idea that they're trying to trick you, or there's some hidden agenda in these cases. It wasn't like that at all. And I think if you're asking the right questions, you're going to get the information. So I think there was some idea that if you've asked them what they're concerned about, they're not going to tell you. But actually, if you're asking it directly, they sort of tell you exactly what you need to know.
So it really depends on the quality of the question then. Um, if you're not asking the right question, then the simulator can't really give you the answer. But if you know how to ask a question, then they will give you the information to help you. Any advice you would give to somebody who is going to sit the exam next week?
I think sort of if it's next week, it's sort of just making sure that you're up to date with the clinical knowledge. Because I remember a week before, I was sort of just looking through NICE guidelines just to make sure that I was, the simple things like acne, um, just sort of day-to-day things that we see, that I knew all of the guidelines, for common topics, really.
Yeah, so it's very important to revisit things that you know you have areas of weaknesses and mapping it on the blueprint, the 12 clinical experience groups, so that you're using your time effectively, especially if you don't have a long time to go for the exam. So thank you very much for sharing your insights with us, Divya. I'm glad that you've managed to get through, and hopefully your insights today has helped a lot of trainees. Um, so have you got any last piece of advice for trainees?
No, I guess sort of, it is possible to pass the exam, and actually it is quite a fair exam compared to the RCA or CSA before. I think it's definitely a fair exam.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye bye.